What is endometriosis? Endometriosis is a chronic and often painful condition in which tissue similar to the lining of the uterus endometrium grows outside the uterus. This abnormal tissue can develop on the ovaries, fallopian tubes, outer surface of the uterus, intestines, bladder, and other pelvic organs. Unlike the normal endometrial lining, which sheds during menstruation, the tissue outside the uterus has no way to exit the body. This leads to inflammation, irritation, and scar tissue adhesions, which can cause severe pain, heavy menstrual bleeding, and fertility problems. Endometriosis affects an estimated 10% of women of reproductive age worldwide, though the exact prevalence is difficult to determine due to delayed diagnosis and misinterpretation of symptoms. Causes and risk factors of endometriosis. The exact cause of endometriosis remains unknown, but several theories have been proposed. 1. Retrograde menstruation. Most common theory: during menstruation, some menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of exiting through the vagina. This backflow carries endometrial cells, which implant and grow on other organs. 2. Hormonal imbalance. Estrogen is believed to stimulate the growth of endometrial-like tissue outside the uterus. Hormonal fluctuations may contribute to excessive cell growth and inflammation. 3. Immune system dysfunction. A weak immune system may fail to recognize and destroy misplaced endometrial cells. Autoimmune conditions may increase the likelihood of developing endometriosis. 4. Genetic factors. Women with a family history of endometriosis, mother, sister, or grandmother are at a higher risk. Certain genetic mutations may make some women more susceptible. 5. Surgical scars and tissue transport. Endometrial cells may attach to surgical scars after a C-section, hysterectomy, or other pelvic surgeries. Some researchers suggest that blood or lymphatic vessels transport endometrial cells to different parts of the body. Risk factors. Women with the following factors may have a higher risk of developing endometriosis: family history, having a close relative with the condition, early onset of menstruation before age 11, heavy menstrual flow lasting more than 7 days, never giving birth, exposure to estrogen-dominant conditions. Signs and symptoms of endometriosis. Symptoms vary from mild to severe and can sometimes mimic other conditions, leading to delayed diagnosis. 1. Chronic pelvic pain, pain before and during menstruation. Dysmenorrhea. Pain worsens over time and may persist throughout the month. 2. Pain during or after intercourse. Dyspareunia. Painful sex occurs when endometrial tissue is located behind the uterus or in the lower pelvic region. Pain can be sharp or deep and continue after intercourse. 3. Painful bowel movements or urination, more noticeable during menstruation. May cause diarrhea, constipation, bloating, or blood in urine, stool, bladder pain, and increased frequency of urination. 4. Heavy or irregular menstrual bleeding, menorrhagia. Heavy periods with large clots. Intermenstrual bleeding, spotting between periods. Long menstrual cycles or irregular flow. 5. Infertility and difficulty conceiving. 30 to 50% of women with endometriosis experience infertility. Endometrial growths can block the fallopian tubes or interfere with ovulation. 6. Fatigue, bloating, and nausea. Chronic fatigue and low energy levels, bloating that worsens during menstruation. Endobelly. Nausea and vomiting due to inflammation. 7. Lower back and leg pain. Pain may radiate from the pelvic region to the lower back, thighs, and legs. Diagnosis of endometriosis. Endometriosis is often misdiagnosed as irritable bowel syndrome (IBS) or pelvic inflammatory disease (PID). Proper diagnosis requires: 1. Pelvic exam. A doctor checks for abnormal masses, tenderness, or thickened tissue in the pelvis. 2. Imaging tests. Ultrasound detects ovarian cysts, endometriomas, but may not reveal smaller lesions. MRI, magnetic resonance imaging, provides detailed images of endometrial growths. 3. Laparoscopy. Gold standard diagnosis. A minimally invasive surgery where a small camera laparoscope is inserted into the abdomen to confirm and remove endometriotic tissue. Treatment and management of endometriosis. 1. Medications, pain management, NSAID ibuprofen, naproxen, reduce inflammation and relieve menstrual cramps. 2. Surgery. Laparoscope surgery removes implants, cysts, and scar tissue while preserving reproductive organs. Hysterectomy, last resort, removal of the uterus and sometimes ovaries in severe cases. Impact on fertility and pregnancy. Many women with endometriosis can conceive naturally. Laparoscope surgery may improve fertility. In vitro fertilization (IVF) may be necessary for severe cases. Long-term outlook and complications. Endometriosis can worsen over time if left untreated. Can lead to chronic pelvic pain, bowel, bladder dysfunction, and depression. Increased risk of developing ovarian cysts and adhesions. Conclusion: endometriosis is a debilitating and complex condition that affects millions of women worldwide. While there is no cure, effective treatment options can help manage symptoms and improve quality of life. Early diagnosis and medical intervention are crucial in preventing complications like infertility and chronic pain. Thank you for watching my video. Please subscribe my channel.